welcome back to Imperial College, and I have with me Mr. Andy Chukwuemeka, cardiac surgeon, but also the medical director for this section of the hospital, Hammersmith Hospital. So, Andy, we want to talk about protecting the institution during this to keep it a functional organisation. What are your thoughts on that?
My first thought really is that we were lucky in some ways. We had a warning because we saw what was happening, particularly in Italy, and we believed that we were about 2 weeks behind. So we had a couple of weeks to really get ready for what we thought was coming. And very important in that was just getting very focused about only doing what really had to be done in the hospital. This is difficult in a multi-specialty hospital, especially a hospital like this with really high-level subspecialty interests, international programs, research programs, and the like, all of which had to be brought safely to a stop. All the patients involved, not just in clinical trials, but in clinical programs, in the middle of treatments, had to be given a plan for what was going to happen to their care. So, for example, we stopped outpatients, face-to-face outpatient appointments very early on. We moved very quickly to telephone consultations and then virtual outpatient consultations. We had to stop doing elective surgery because we recognized that there would be a great need for the skills of our anaesthetists and intensive care doctors, and they couldn't be deployed looking after routine clinical cases when we had this predicted wave coming 10 days, 2 weeks down the line. So we had to manage that. It's very, very difficult to say to patients who know that they have cancer that we're not going to treat you right now. Not because we don't want to treat you, but because we believe you would probably be better off not being treated now and running the risk of perhaps getting COVID during your hospital stay, because we believe that's what will happen in this hospital in weeks to come. So managing that was a protection for the institution, but also a protection for the patients as cohorts and also right down to the individual level. You do have to manage the staff in that process as well. It's very difficult to say to doctors, I'm so sorry, but your life's work is going to come to an end, hopefully just temporarily, but that is what is going to happen in the next couple of weeks because we have got other priorities at the moment. But I think we've managed that and we've kept most people on board, and people have actually been fantastically helpful being redeployed to other areas. So we've had very senior clinicians acting as what we call bed buddies, also ward helpers in the intensive care unit, donning all the protective equipment and literally just fetching and carrying for the intensive care doctors to allow them to get on with the job they need to do. So it's been a challenge, but people have risen to that challenge and really come on board to protect themselves, the institution, and of course our patients.
Okay, thanks very much.